Good morning, good morning, good morning. This is a fantastic, great, and can be and will be a happy new day. Welcome to day 93 of the Free to Hope 12 Steps Apply to COVID-19. Yes, day 93 of me and 7 family members surviving COVID-19. The Creator breathed life into you this morning, breathed life into me this morning, woke you up this morning, woke me up this morning to make this a happy new day in spite of all physical conditions that we are going through right now. FREE stands for From Recovery, Emerge Empowered, to give hope to others, help others prosper equally. Applying these 12 steps that are spiritual in nature, created by the 12-step program of Alcoholics Anonymous over 80 years ago, I stand before you with 31 years in recovery as of February the 23rd of 2021, only by the grace of God. So having utilized these 12 spiritual principles for my alcoholism, drug addiction, and the lifestyle that goes with it, I am now applying them to COVID-19. Why? Because I was responsible for contracting COVID-19 and infecting other members of my family from as young as 2 years old to 78 years old. But God allowed us to breathe, allowed us to smell, allowed us to taste, to swallow, yes, to feel, to hear. But the main goal is to listen. And so with that, we want to thank our God, your creator, the force, whatever you choose to call them, but you didn't breathe life into you this morning, and I didn't breathe life into me this morning. So therefore, we want to give 30 seconds of silence in homage of our creator, as well as those who have transitioned from COVID-19. The numbers are increasing, and it appears that it's going to get worse before it gets better. But thank God he knows the beginning, the middle, and the end of this pandemic. It's not the first pandemic, nor will it be the last pandemic that we go through and have during this lifetime here on this earth. So we know that we can be a part of the solution and not a part of the problem. If it's just one person at a time, one family at a time, one culture at a time, one community, one city, one state, one country at a time. And if we utilize these 12 spiritual principles simultaneously and holistically around the world, we can, we will, we must stop the perpetuation of this devastating virus and the upcoming virants. They are among us already. So for those who have transitioned, for those who were left behind of losing loved ones to COVID-19, those who are on their dying bed this very second, those who are suffering from the severe symptoms of COVID-19, those who are intervening on the behalf of those with COVID-19, those who are doing the next right thing regarding COVID-19. And yes, those who are still in denial, still defiant, still egotistical, prideful, stubborn, self-centered. Yes, even them. We want to do a moment of silence for the entire human race because we are all in this together. Join me for just 30 seconds in a moment of silence to our Creator and those of us as a human race combating this coronavirus pandemic. Join me. Thank you, thank you, thank you. In the 12-step program of Alcoholics Anonymous, we often do a moment of silence for the still sick and suffering alcoholic inside and outside the rooms of Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, Overeaters Anonymous, all 12-step programs that are focused on specific areas but utilize the same 12 spiritual principles. We pay homage and give a moment of silence. Why? Because there, by the grace of God, there go I. And so by acknowledging our higher power, who I choose to call God, and acknowledging those in the human race as we simultaneously go through this coronavirus pandemic. We also say in our 12-step program that some of us must die in order for some of us to live. And you may say, Edwina, why would you say that? Because it's the truth. It is the truth. Why? Because there are some of us who are just we are not capable of being honest with ourselves. We seem to have been born that way. We're not at fault, just constitutionally incapable of being honest. Therefore, that self-centeredness, that defiance, taking COVID-19 for granted, being selfish, being self-centered, why? That is going to cause your or mine and others' death. And that's why they say some of us must die in order for some of us to live. But for those who are living, do we learn from those who have died? Have we talked to people who have died from COVID-19? And they will ask you, or you would, you would ask them, what are your if I coulda, woulda, shouldas? And if you listen to them, then maybe you won't hear them. You will actually listen to them. And I sit before you asking prayerfully, hopefully, that you listen to the words that come through my mouth, through the Spirit, using this vessel. Because I, too, was one of those who, even in spite of having the information, these 31 years, did not apply it to COVID-19. I picked and choose when I wanted to wear a mask. I picked and choose when I wanted to social distance. I picked and choose when to wash my hands. I, in essence, started taking this COVID-19 for granted. I had an attitude of being invincible like I did in my addiction with alcohol, drugs, prostitution. No, I won't ever do those things. I won't ever drink a drug. It won't happen to me. But guess what? It did. And so did COVID-19. And I infected members of my family. So yes, I sit before you hoping you will listen. And a seed is planted just to save your life, the lives of your loved ones, and the lives of others by doing the simple suggestions. The researchers, the medical, the other factors are begging us just to follow the CDC suggestions. Wash your hands, wear the mask, social distancing, contact tracing, get tested, and get vaccinated. I'm speaking from my own experience, but I'm also speaking from the experiences I have learned from others. I have gained some wisdom now. I have achieved a psychic change now as a result of contracting COVID-19, and it was only my higher power who chose me and my 7 other family members to live. So I am passionate about what I'm sharing with you. And I hope you become passionate so you can share it with other people. All right? So how did I get here? Guess what? On March the 31st of 2020, Dr. Scott T. Allison had an article in Psychology Today, and the Spirit used me to hit that go live button on April the 1st. And I've been sitting before you ever since. So if you want to go back to my podcast as early as April the 1st of 2020, when I present these 12 steps while we're doing that initial stay-at-home order, and you will see the progression of the 12 steps working in your life and the lives of others. And if you want to see what COVID-19 looked like on me, listen, you might be from Missouri. Let me show you right now. Right there, you see me on December the 3rd, sitting before you, looking just like that picture. I didn't have these pearly white dentures in. I was aching. I had a headache. My tasting capacity was affected. I could not smell to my full capacity. But the main thing, I could not breathe to my fullest capacity. Yes. And so, as of December the 3rd, if you want to go back and see how I reapplied these 12 spiritual principles to my life and introducing them to you regarding and specifically to COVID-19. All right. So they're uploaded on YouTube, Instagram, and Facebook, and whatever other platforms I can use, I will. Empower for Me Network. All right. All right. So let's acknowledge my sponsors. Let's do that first, because what I'm learning is that the information is free to the public, but I can utilize sponsors to help me spread the word. Hold on a second, y'all. Let me stop and take a sip of coffee. You can't imagine being able to breathe and being able to taste. If you didn't have it, oh my God, I don't want you to go through it. But thank God he is who he is and spared my life and prepared me to sit before you, because yes, I am transparent. I am as honest as I can possibly be. I will not tell you the lies. I might tell somebody else a lie, but I ain't gonna tell you a lie, right? That's why we have the 12 steps, because we are work in progress. All right. And so God uses broken, shattered, and wounded people like me and like you to rescue wounded, shattered, and broken people like me and like you. And so we want to get this information out in the world. Even where this COVID-19 is, I'm prayerful that this information will go out and touch at least one life, one family, one community, one city, one state, one country. And we have that duplicated and replicated in the entire world. Why? Because we have to do it. Our Creator's going to do his thing, but we are the instruments. We got to do what is suggested. And like we said in recovery, do you want to save your behind, or do you want to save your face? If you want to save your face, you just might die and you won't have no behind anyway. So recovery is about saving your behind, taking off those masks that we've been wearing all our lives, addressing those attitudes, ideas, and behaviors and actions and decisions that have not been working for us, that have been mostly self-centered. Now we have an opportunity with something we have no control over, this COVID-19, but there are solutions and they are in the steps. And so when I list my sponsors, they believe in this cause. They believe in helping me getting the word out. Yes. And so I am asking you to patronize them, right? And support of spreading this information around the globe. And they are, oh, Lord, I love you. Okay. So no. No, I don't want to do that yet. No, I don't want to do that. Okay. Our sponsors are MDB Associates, Dr. Mary Douglas Bailey, Patchwork Human Services, LLC, Ebony Madry, Levante N. Dorsey and Associates, LLC, Academy of Peace, my dear friend, spiritual advisor, Dr. J. Macklin, Crafty Crab Seafood Restaurant, where I had my 31st celebration at, and they were implementing the CDC suggestions as a public facility, and we did our part by wearing our mask and social distance, right? and free to hope, from recovery, emerging power to hope. Help others prosper equally. Okay. I had to split the page because I'm still getting sponsors in, but I just want to make sure that I don't miss anyone, right? So let's go here. And I want to acknowledge, okay? Oh, come on now. You're going a little too fast for me. All right? Listen, patience is a virtue, I tell you. All right? Then we have Women Do Haul Transportation Services, LLC. My crown that I'm wearing is from Mr. C's Barbershop, Mark Cooper. Some of the outfits I wear are from Morgan's of Delaware, and my Afrocentric attire is from Lady T at Morgan's of Delaware. The jewelry I wear at times is by Catherine Butler, and the one that is parallel to what we're talking about is Divine Light Recovery Center and Supportive Housing. Dr. Carl Jung, Dr. Bob, and Bill recognized that religion was limited to helping the persons with the disease of alcoholism. The medical field was limited, but between those three men, they, through God's Spirit, recognized that we, with the disease of alcoholism, any disease really, we need divine providence. We need divine intervention that will bring us to the divine light. We incorporate, learn, implement, and practice these 12 spiritual principles that will help us achieve a spiritual experience, bring about a spiritual awakening, increase our spiritual maturity so that we can achieve that psychic change and address those old and existing attitudes, ideas, and behaviors. Learn this information, apply them, and practice them so that we can deal with anything that's physical on this journey called life, but from a spiritual angle. Dr. Lawrence, Donald Lawrence says it so sweetly. We are not a human. We are not a spiritual being having a natural experience. You are not a natural being having a spiritual experience. We are spiritual beings having and walking this natural journey. So anything that we have to deal with on life, we apply these 12 spiritual principles to address it. And we practice these principles in all our affairs. So as a result of the sponsors, please support them. I want to acknowledge my resources that I use. I mentioned Dr. Scott T. Allison, and in his article on Psychology Today, and this is what he wrote and focused on 7 points regarding COVID-19. The resource is Dr. Scott T. Allison, Psychology Today, March the 31st, 2020 edition. How wisdom of the 12-step programs can help get us through April. Well, guess what? We in a new year, we're in a new month, and we have a new day. But we can make it a happy day because he expressed 7 points from the Al-Anon perspective, which is another 12-step program using the same 12 recovery principles. Focused on 1, letting go of control regarding COVID-19. 2, practicing patience regarding COVID-19, but act fast to save your life. 3, keeping the focus on oneself. Stop worrying about what other people are doing. You do the next right thing. Trust in our higher power. Trust in the process. Trust in the fact that we have to rely on others to get the information correctly. 5, living in the present. What you do right now, this moment, will decide your next step and your future. Social connections. Yes, even though we have to practice social distancing, we still can be connected like we're being connected right now. You can see me and I can see you, maybe through the FaceTime or whatever, but social connections is important. And then 7, service to others. We are born to serve, okay? My other resource that I use is Jason Waller. Now, when I went to look at how I was going to present the 12 steps, And I went and I searched the website, and I came up with Jason Waller's, right? He has a podcast. He has an awesome website, and he breaks down the 12 steps of Alcoholics Anonymous in terms of his experience, his strength, his hope, and his wisdom. And he presents narratives and questions to help us understand the importance and the spiritual angle from all 12 spiritual principles. So please go to jasonwaller.com, extract and print those 12 steps as illustrated by Mr. Waller. Okay. Next, I want to show you what the 12 steps are. Now, you may say, Edwina, you showed this yesterday, but guess what? In a 12-step program, repetition is so important. So here are the 12 steps when we apply them to COVID-19, but not alcohol or drugs or overeaters, right? We admitted we were powerless over COVID-19, that our lives had become unmanageable. 2, came to believe that a power greater than ourselves could restore us to sanity. 3, made a decision to turn our will and our lives over to the care of God as we understood him. 4, made a searching and fearless moral inventory of ourselves. 5, admitted to God, to ourselves, and to another human being the exact nature of our wrongs. 6, were entirely ready to have God remove all these defects of character, right? 7, wait a minute, let's go back. See, one thing I learned about these computers, you got to take your time. 7, humbly asked him to remove our shortcomings. 8, made a list of all persons we had harmed and became willing to make amends to them all. 9, made direct amends to such people wherever possible, except when to do so will injure them or others, even you. 10, continued to take personal inventory, and when we were wrong, promptly admitted it. 11, sought through prayer and meditation to improve our conscious contact with God as we understood him, praying only for the knowledge of his will for us and the power to carry it out. And 12, having had a spiritual awakening as a result of these steps, we tried to carry this message to others regarding COVID-19 and to practice these principles in all our affairs. So, repetition is crucial in a 12-step program. Why? Because we never know when a student becomes ready and he needs the teacher to appear. We never know when the student is ready to go to the next level, so additional teachers can appear. What you heard, or you said that you hear this last week, you may need to hear it again until you get to listen. And repetition is crucial. That's why with 31 years in the program, one day at a time, the more I read, the more I grow. The more I practice, the more I grow. The more I implement, the more I grow. Why? Because life on life terms, you never know what's going to come down the pipe. But I know that we in a 12-step program can apply these spiritual principles in any physical conditions. All right. So I wanted to say that with the 12 steps, my resources, and my sponsors before we go into our recovery conversation today. Now, we also know that this is the month of March, and the month of March is Women's Month. And today is appreciation of women, right? Recognition. So I want to, where you at, Mama? I want to recognize my mother. Oh, sorry about that. Helen Jones Lamar Hall Taylor. This is me laying in her arms. She's looking up into the heavens before she transitioned, praying for all of her 6 children, 4 of which were on drugs. The same time, I happened to be the worst, but God prepared me like he prepared me now to be there for her and to be there for you. So homage to my mother, Helen Jones Lamar Hall Taylor. I also want to acknowledge my auntie mama, Margaret Matilda Kemp Williams. She had an integral part in my development, my character, my personality. Even though she didn't have any children, I look just like her, and she chose me out of the 6 to help with my mother. So I pay homage to this great woman, Margaret Matilda Kemp Williams, right? So learn to acknowledge people in your life today. Give them homage today. Tell them you love them today. Practice being kind today, because we never know what's going to happen the next minute, the next hour, or even in this day. Don't put off tomorrow what you can do today. Like, put on the mask, wash your hands, social distancing, contact tracing, get tested, get vaccinated. Why? Because it can put you in a position for you not to say, if I coulda, woulda, shoulda. No, you are listening right now, and you are allowing your spirit to infiltrate it so that you can hear, but listen to what we're saying. Tell your loved ones, protect your loved ones. Or would you want to be like the other ones? God bless them anyway. But they still can benefit from these 12 spiritual principles if they just practice these 12 spiritual principles and implement the CDC's simple suggestions, okay? All right, let me show you that because I survived COVID-19 by my God and 7 other family members. This is day 93 of being in recovery. I just got tested, and let me yes, I did. I got tested because I was around somebody about 2 weeks ago, and I wanted to get tested again. But I had my first vaccine shot on February the 6th, and I got my second shot on March the 4th, right? And so I had to, like many of you, do my research, do my homework, ask questions about this vaccine. And what I learned and what I'm going to share with you, and I hope you listen, the vaccine only decreases the severity of the symptoms should you contract COVID-19. Therefore, you won't have to be hospitalized, and therefore you will survive without dying from COVID-19. So I understand a little better by doing my research, asking questions, talking to other professionals, right? And I made up my own decision by trusting in the Creator, who will tell me, show me, direct me to do the next right thing regarding COVID-19, come out of that selfish and self-centered mode into God's will, right? And so let me show you the first shot that I got from on February the 6th, right? So here's me getting my first shot. Let's go back. Dr. Joan Coker. Now look. I ain't trying to scare you, but look how big that needle is. Woo. But guess what? Ain't the first time I got a needle, right? And it won't be the last. If it's going to save my life, stick me. I'm good, right? So here goes the second video that I have with taking the second shot here recently. Okay.
All right.
Here we go. And this time I didn't even feel the shot, right?
Yes.
All right. So there you go. I got vaccinated. Yep. Okay. All right.
Did it.
Yes. And so I'm sharing that with you because one of the things that we have to do is dispel any rumors or try to come up with any excuses not to take the vaccine shot. Again, I've learned by asking questions. I've learned by reading, doing my research, that the vaccine only diminishes the severity of the symptoms should you contract COVID-19. Therefore, you might not have to be hospitalized and meet the fatality of COVID-19. I can still get infected by COVID-19. I can still infect others with COVID-19. And so by having this vaccination, I've learned that it only diminishes the severity of the symptoms. I still have to wash my hands, practice social distancing, wearing the mask, getting tested, right? Contact tracing, all right? So if I can, you can too. And so we want to just show again why we have to keep repeating. We have to keep repeating because people still don't want to hear. And oh my God, all these states are dropping their mask restrictions and they're opening up. So you see why this thing is going to get worse. It's going to get worse. But you don't have to be one of the ones that get victimized by not doing the right thing for others, particularly your loved ones. My grandchildren see me wear my mask. They see me wash my hands. We talk about social distancing. We don't need to go to public places. We don't have to. And where appropriate, we get tested. And age appropriate. And when it comes, they're going to get vaccinated. Because this thing ain't going nowhere no time soon. No, it's not. Because of some of us being defiant, rebellious, stubborn, self-centered. Oh my God, in the 12-step program, we realized how selfish we were and are with our disease of alcoholism. And we applied to COVID-19. We are still selfish and self-centered, which is why recovery principle number 4 through 7 are crucial. And to learning about what's wrong with you, but what happened to you, what happened to me, to bring about those negative attitudes, ideas, and behaviors that are designed to affect my life in a negative way, even if I like them or not. They are character defects. Just the word defect should be enough. Should be enough for us to want to change and be a part of the solution and not a part of the problem. All right. Can I take a drink of coffee? All right. These steps will also help with the other ripple effects of this COVID-19. Mental illness, increase in substance abuse, increase in suicide attempts, increase in domestic violence, child abuse, neglect, This COVID-19 is and its impact, effects, and outcomes and fatalities is taking a toll. Yes, it is. And that's why I thank God for preparing me to sit before you to share my experience, my strength, my hope, my wisdom of the 12-step program, but also my lack of wisdom, my bad choices, my bad decisions, and how I contributed to contracting COVID-19 and infecting members of my family. And I want to share with you that you don't have to make the same mistakes I made and mistakes others have made. They say a smart person learns from their mistakes, but a wise person learns from the mistakes of their own and of others. So I'm going to ask you, are you in the prevention, intervention, or restoration mode of COVID-19? Are you being proactive, reactive, inactive, or responsible regarding COVID-19? Well, let's find out as we continue with recovery principle number 7. Woo! All right, let's do this quick review real quick. So we know that we have talked about recovery principles 1 through 6, right? And we know that recovery principle number 1, we focused on why we need to admit we were powerless over COVID-19 and how our lives have become unmanageable. This step needs to be taken 100%, total acceptance without any reservation. 2, came to believe that a power or powers greater than ourselves could restore us to sanity. And sanity only means soundness of mind. If you have a problem with the God thing, then use the CDC's suggestions and research as a power greater than you. You need to talk to somebody with some tangible evidence, like that picture I showed you, what COVID-19 looked like on me. Use that as a power greater than you. Go and talk with somebody who have lost loved ones to this COVID-19 and allow that to be a power greater than you. And when you come to the realization that that there is a God of your understanding, then let that power direct you to do the next right thing and restore you to soundness of mind. 3, made a decision to turn our will and our lives over to the care of God as we understood him. If that power or powers greater than you are working for your good and in your best interest, why wouldn't you keep making that decision to turn your will and your life over? Remember, this is a one day at a time program. This is a one day at a time COVID experience. And if we don't practice social distancing, washing our hands, contact tracing, the whole 9 yards, we can succumb to contracting COVID-19. Number 4, this is where that searching and fearless moral inventory is. When, where, and how were your character defects formulated, such as selfishness, defiance, stubbornness, egotistical, prideful, having that attitude of being invincible. This is where the work comes in, that we actually begin to see ourselves on paper. And once we identify those character defects, you hear the word defects, right? Character defects, we admit to God, to ourselves, and another human being. And recovery principle number 5, for that person to help us get to the exact nature of those character defects. And then we come to 6, we're entirely ready to have God remove all these defects of character, not some, but all. And so let's see what that process looks like. For those who are now listening, those who didn't get it the first time, we're talking about I had the character defect of resentment about COVID-19. That was masked by anger. Anger was masked by uncertainty. Uncertainty masked by confusion, frustration, disbelief, and I got to the exact nature of being fearful. I even had a resentment against myself because I allowed my stupidity, right? To override my resentment. And that was camouflaged by defiance, rebellious, selfishness, self-centeredness, regrets, remorse, fear. Again, it's the exact nature. So in recovery, we learn not to forget everything and run, but to face everything and recover, particularly when it comes to COVID-19. All right. So now we're at recovery principle number 7. And I will put it to you in another way to give you an example. Listen, I'm from Missouri, not literally, but you may need to see it yourself. So when we emphasize recovery principles 4 through 7, this is what it looks like. Lying is one of my character defects. Lying identified as a character defect. And step 5, with that person, I learned the exact nature of lying was identified as fear. And step 6, I became entirely ready to have God remove the defect of lying and the defect of fear from me. And then after having knowledge and awareness of this character defect and the exact nature, when I feel the need to lie again, am I about to lie or have lied, I can ask God to remove that shortcoming of lying and fear from me. And that is in recovery principle number 7, right? So now we want to focus on the questions that we talked about yesterday regarding Jason Waller. All right. And so what I'm going to do is, before we get to the questions, let me recap what the narratives are as we move forward. So we talked yesterday and the day before, this is day 10, I believe, of recovery principle number 7. That step 7 of COVID-19 Anonymous program of recovery is about getting rid of character defects and replacing them by practicing humility and spiritual principles, right? We talked about how the word humility is the solid foundation of all virtues, right? We also talking about wishing our character defects away does not happen, right? And it's in God's time and in God's way how he's going to remove those character defects that stop us from doing the next right thing, doing his will, right? Come on, Nene. And from doing what is the appropriate thing to do in order to save one's life, right? We also talked about being, you want to come over here? We also, that's my granddaughter. She was just, come here. It's okay. Hey, listen. Okay, thank you. Thank you. Can you come here? She said I got lipstick on my teeth. Okay. I'm taking them out for you. Come here. Mm-hmm. This is the one. This is the one. Come on. This is the one that she was the first one to contract COVID-19. How old are you now? What's your name? I can't hear you. What's your name?
Amira.
And what school did you go to? Try to be still.
Mac.
Oh, okay. So anyway, but this is my granddaughter, and this is the one that started this process called COVID-19, right? So what you get ready to do now?
I want to clean.
Okay. All right. Take care. Yes. So again, identifying what the issues are, which prevents us from doing the next right thing, prevent us from being restored to sanity, right? Just soundness of mind. And so these questions that I'm about to go over with you helps us to get to our right size. It says part of getting right sized in step 7 means making changes with the activity of our minds. You hear that? Making changes with the activity of our minds. I'm talking about that psychic change that occurs when you do steps 1 through 6. In addition to accepting and expressing our emotions. He goes on to say we learn to gradually bring the different parts of ourselves into a healthy balance as we practice new living skills like putting on the mask, washing your hands, social distancing, contact tracing, getting tested, and getting vaccinated, right? New living skills. We don't know how long we have to do these things, but guess what? If you want to live, you'll do them as often as you're supposed to do so that you can save your life and save the lives of others. Okay? So now we have the questions that are offered through Jason Waller's breakdown of the 12 steps. He has some questions as well as affirmations. So let's start our appetizer with the first question. All right, you ready? Okay, so let's see here. All right, the first question by Jason Waller says, how has my understanding of my higher power grown? How has my understanding of my higher power grown? Question number 2, how have the previous 6 steps prepared me for step 7? 3, how does being aware of my own humility help when working the 7th step, right? Let's go to 4, right? And 5. So let's see, come on now, take your time, Edwina. Going too fast here. 4, it says, how do I plan to ask a God of my understanding or higher power to remove my shortcomings? 5, am I comfortable with prayer and meditation, even if it means making up my own? 6, has my sense of perspective or reality been out of proportion lately? These are some of the questions by Jason Waller, right? Breakdown. He uses other resources and includes his experience, strength, and hope to drive home the point, right? Then we get to question number 7. Have there been times when I have been able to stop from acting on a character defect and practice a spiritual principle instead? And 8, are there any shortcomings that have been removed from my life or at least diminished in their power over me? So we are going to decipher, marinate all of these questions so that we can get a better understanding of why the 7th step is important and how we could benefit from it spiritually. Okay, so let's look at the very first question. How has my understanding of my higher power grown? How has my understanding of a higher power grown? So if we embark on recovery principles 1 through 6, we know that we admitted that we were powerless over COVID-19, and we can see our lives unmanageable in a holistic manner. And in recovery principle number 2, we came to believe that a power or powers greater than us, whether it be the CDC suggestion, whether it be Dr. Gupta and his staff, okay? But what information has been brought about to help us to make the right decision regarding COVID-19? And we recognize that man is limited, right? Man is limited. And so if the creator knows the beginning, the middle, and the end, I would think, wow, what can I do to align myself up with God's will during this pandemic? And so even with the CDC suggestion, and we get to hear the experiences of others who have survived COVID-19. And I'm going to be bringing some people on to share their experience, just wisdom, lack of wisdom, bad choices and bad decisions, so that you can hear it from the horse's mouth, right? But we see that they will tell you it was their redevelopment or reestablishing their faith in a creator that's greater than them, right? And when we went to 3, we know that we had to make a decision to turn our will and our lives over to the care of our creator, the care of God as we understand him. In the 12-step program, we don't ask you, we don't make you, we don't demand you believe in anything. We only suggest that you get a higher power of your understanding and knowing that it is not you. So when you establish that personal relationship with your higher power, you are turning your will and your life over to that higher power so that you can align your will up with his or hers will, right? And how to be a part of the solution and not a part of the problem when it deals with COVID-19, right? And then when we get to 4, we know that we did that inventory and we needed to find out, Edwina, why are you so stubborn? Why are you so selfish? Why are you self-centered? Why do you have that feeling of being invincible? Let's explore that. It's nothing wrong with you, but something did happen to you for you to formulate those attitudes, ideas, behaviors, decisions, choices that are destroying your life and affecting your life in negative ways and with other people. Find out what happened to you so that these 12 spiritual principles can create that spiritual experience, bring about a spiritual awakening, increase your spiritual maturity for you to achieve that psychic change. Putting on the mask. Take them other masks off and put on a mask that's designed to save your life. Wash your hands. I don't care if they become whatever, cracked. Just keep a whole lot of lotion. Because when we touch, feel, grab things, and we use it, come on now, wash your hands. Some of us don't even wash our hands when we go to the bathroom. I'm guilty of that sometimes. I told you I'm transparent, I'm honest. But you better believe I'm washing my hands every chance I get. And my grandchildren are watching me, and I need to be the attraction. I need to be the role model. I need to be the leader of this particular family of mine, and you can be doing the same thing. So when we get to 5 and we learn the exact nature of those character defects, it is based in fear. Oh, it's based in fear. But the 12 steps have a solution for that. Instead of using the acronym for fear as forget everything and run, and in recovery, and I'm sure some of y'all say F it and run. I ain't wearing no mask. I ain't washing my hands. Uck it. I'm doing what I want to do. Yeah. The big old bad I am. Yeah, well, guess what? You didn't breathe life into your body this morning. I didn't breathe life into my body this morning. So come on, get the stepping. 1 through 6, right? And once we go to 5, we are entirely ready to have God, your higher power, your creator, remove all defects of character. Could you imagine, by holding my little granddaughter who just left here, could you imagine her being in a hospital, her succumbing to the fatality of COVID-19 because of me? One of her guardians, right, took it for granted, took COVID-19 for granted, did not follow through what they suggested I do, and the outcome could have been different. But the outcome has happened to babies, to children, to seniors, any and everybody. That COVID-19 does not discriminate, just like alcohol and drugs. They don't discriminate. There's no big I's or little U's, huh? So when we admit our powerlessness, we have to ask ourselves, what can I do to help save me, to help save my loved ones, to help even save you? What can I do? And that's when we become entirely ready to have this God remove all and anything that stands in the way of us doing some simple things. Washing your hands, wear the mask. Listen, wear the mask. Social distance, contact tracing. Get tested. Out of the 8 of us who had COVID-19, only 2 of us had symptoms. Me and my 2-year-old grandson. My total body ached like a toothache. I could not breathe to my fullest capacity. I can do that now. I can do. Look. I know y'all from Missouri. Listen. Here I go. Look at me. Look at me now. Look at me. Look at that picture on the side. You see? I was sweaty. My dentures was out. I was achy. I couldn't swallow. I couldn't smell. Right? Thank God I didn't have a fever. But again, that goes to show you what COVID-19 looks like on me. And so as a result of having contracting and infecting other family members, we have to be mindful of those who don't have any symptoms. And even with that, we take it for granted. But we're sharing. They told me, but I was not listening. So I am aligning my will with God's will to help me have that spirit of discernment, have the spirit of doing the next right thing for the right reason, one of saving lives, not destroying or taking them away. All right, so that's how my experience, right? That's how my experience of this first question, right, that we talked about, how has my understanding of my higher power grown? Now, if you can go through those 6 steps, if you can see the spiritual angle from steps 1 through 6, you should see how your understanding of your higher power, whoever you choose to call him, has grown, right? All right, that's important. And the other thing that we want you to understand is that it's a journey, it's a process, right? And it says how. We need tangible experiences. Just like, if you want to ask yourself, who woke you up this morning, Who woke you up this morning, right? Who breathed life into you this morning, right? It wasn't the birds. It wasn't the trash truck. It wasn't your spouse, your children. The Spirit of God woke us up this morning. Some people will not wake up. They are in transition right now. Yes. So think about some tangible things that you can touch, see, feel, hear, listen, and see how your understanding of a higher power, whoever you choose to call them, have grown, and how much you need to depend on that higher power. Huh? Yes. All right. So question 1 was, how has my understanding of my higher power grown? Okay, let's go to question number 2. How have the previous steps prepared me for step 7? Okay, how have the previous 6 steps prepared me for step 7? Now, remember, step 7 says, humbly ask him, capital H, to remove our shortcomings. So that means I'm aware, like the example I use, I'm aware of lying. I'm aware that the exact nature of lying is fear. I am presenting my self to this God of my understanding to remove all character defects, right? But step 7 is a present step, right? So when I feel like I want to lie, I can ask this higher power of mine to remove that shortcoming. But let's hone it into COVID-19, right? I gave you the example yesterday. How have the previous 6 steps helped me with recovery principle number 7? The idea of a mask, right? Many of us have gotten used to wearing a mask. Some of us, like me, forget to get the mask and put it on. So are we aware and are we conscious of that? So when we recognize we don't have a mask, what do? Do we turn around and go get it? Do we change them up? Do we put them on, not carrying them in our pockets, whatever? Do we put them on? And the other question is, if you don't put them on, what do you need to do? To ask your higher power to remove that shortcoming of being defiant, of being stubborn, of being impatient. Yes, ask him right there, right now. Help me to turn around, go get that mask, put it on my face, and keep it on. That's what's humbly asking to remove my shortcoming. Oh, I left it in the car. It's too far away. Oh, they're not going to let you in. Oh, let me use my shirt. No. Ask him to remove that shortcoming so that you can do the next right thing for the next right reason in order to save your life and save the lives of others. Humbly ask him to remove your shortcomings. And that's why the previous 6 steps can help with that. All right. I done got a little hoarse. All right. It's okay. Now, I'm gonna stop there, but we are going to continue with the steps tomorrow. We're going to start back with question number 3. Just let me give you a teaser here. How does being aware of my own humility help when working this 7th step? You hear that? How does being aware of my own humility help when working step 7? All right. So let's go back, and I want to say, if it's God's will, that we are rejoined tomorrow for day 94. I pray that if he chooses to wake you up or to wake me up tomorrow morning, we will be reunited. In the meantime, I would ask that you support my sponsors here for information. The information is free to the public, right? I'll wear your mask and advertise your business. If you want to help me expand this platform to get the word out, Cash App $free to Hope. Email me at edwina.bell@yahoo.com or 302-690-6679. So these are some of my sponsors, and these are the others. So I definitely want you to patronize them, because many of them do have recovery in their establishment, right? And so I want to, again, thank my sponsors here on the screen. I also want to show you, before we leave, me getting my 2nd vaccination Yes, by Dr.
15 minutes. All
Joan
right. And you'll be
Coker.
out the
Here it
door.
is.
All
All
right.
right. So I got my shot, right? My second shot. I'm from Missouri. I know not literally, but you may be too. So let me show you what it looks like. All right. And then I want to encourage you all to make sure that you do the simple
Just
suggestions
15
of
minutes.
washing your hands,
All right.
wearing the
And you'll be
mask,
out the
social
door. All
distancing,
right.
right?
Let me get a
You
film
want
picture.
to
Sure.
also get tested. You want to get you want to get the vaccine shot, okay? So if it's God's will that we are reunited, be safe, wear the mask, do whatever is required to save your life and the lives of others. Until we meet again, if it's God's will, be safe.